Please be careful. Be responsible.
Some patients receiving care for different conditions, including cancer, are worried about what will happen as hospitals postpone some treatments to focus on who'll need every bed.
I live with my husband and my 3 children. I'm also living with the coronavirus.
After struggling with a chest infection, she couldn't shift. Lexi Taylor from Suffolk believes she has the virus and is coping with her 3 kids. She says her husband's being forced to still go to work on the factory floor.
I need him here to support me and to stay indoors like the government have said. Stay at home. Don't go out for anything that's non-essential.
What is essential? Thousands packed the trains during London's rush hour this morning, stretching the loopholes perhaps. Crammed on tubes, cheek by jowl, on busy building sites too. Is it really possible to keep our distance? Scotland's First Minister isn't sure.
We've been asked specifically about construction sites in Scotland. We would expect them to be closed.
For the first time, journalists were asked online to put questions in Number 10. The Health Secretary began with the quickening pace of the disease.
Very sadly, overnight, 87 more people have died, bringing the total to 422. And our hearts go out to their families and their friends. Yesterday, the Prime Minister announced the most radical steps yet to slow the spread of this virus. And these steps are not requests, they are rules. Go to work where that work can't be done at home. And if you're a key worker, for instance, if you work in the NHS and social care, then you should go to work.
And there was rather unlikely public health advice for couples who don't yet live together.
Test really carefully, you're stood.
A lighter moment, maybe, in a serious time when the limits on our lives are growing. Police in Plymouth, politely, asking drivers where they're going. So much change already, and this really is hardly the start. Laura Kunsberg, BBC News, Westminster.